Hello and welcome back to the channel. Thank you for joining me in another of my wonderful interviews. Now you're feeling a bit grim, you've got a temperature, feeling a bit sort of under pressure, need to go and see the GP, worried about your health. Well, just hold it there because there might be an alternative to the old GP. You'll know that I've had Catherine McBean on the show many times, and she's been talking about the People's Health Alliance. She's also talking about the People's Farming business. Well, it's health we're interested in today, and I've got two lovely ladies on the line from the People's Health Alliance, and they're going to give us an update on all the exciting things that have been going on in that area. So welcome to the show, Lisa and Amanda. Hello, Lisa and Amanda.
Hello. Thanks for having us.
It's lovely to hear from you. I said in the intro there that, people are obviously thinking about their health. They may have had a certain medical intervention thrust upon them and wondering if they can trust their old GP. But I know that what you guys do at the People's Health Alliance is you're giving alternative ideas to people so that they're not forced necessarily down that one-size-fits-all thing that we've been used to since whenever it started in the 40s or 50s.
Absolutely. Yeah. I mean, in terms of PHA, for those that aren't aware of who we are and what we do, we kind of set up 2 years ago, actually today, birthday today, and with the idea that we wanted to we'd had enough of, the mainstream approach to health, which is a pill for every ill, and it's really important that we look at preventative care and health creation. So the idea was to try and gather the troops around and create health hubs, integrated health hubs within their local area that could be for their people, for the people of their community, whatever suited their needs. And that has just kind of grown from strength to strength, had an incredible amount of support with people in the UK and now worldwide as well, who have also just taken this and run with it because it's being built by everybody for everybody, which I think is the key here, that decentralised model.
So
And empowering people to take control of their health again, because so many people have forgotten that they have the power to decide what they need. And so we just try to give a fully integrative approach to health to enable people to look at different options, speak to different practitioners, and decide what's working for them.
Now, I must say, happy birthday then. If you're 2 years old, that's really great. Good to see these initiatives, actually lasting, because so many things do start up and then they peter out, especially if they're sort of volunteer based and that sort of thing. I'd also just like to say, just so that the audience know, that on the left hand side of the screen you've got Amanda and on the right hand side you've got Lisa. Is it possible that, Amanda, you can get just a bit closer to the microphone, whatever it is that you're recording the mic, or slide the microphone a bit nearer to you, because we were just losing you a little bit there in terms of volume. So I know that I came along to your fundraiser last year, and that was very successful. That's obviously helped, these sort of things help the things that you're up to going. Can you tell us what's happened in the last year then?
So the gala dinner we held in September, and you very kindly stepped in as our compere for the evening. And the gala dinner was a fundraiser. We're a very small team of people at the core, and we do have running costs. We try and keep them to a minimum. So it was to help with that, but also to create some funding for key projects such as the mental health project that we can talk about in a bit. But also it was very much about building awareness and encouraging people to step up in their communities, to join create hubs, and come back together in our communities. That's how we're going to do this. We're going to change things and build new ways by coming back to our community.
Absolutely. I mean, and these things don't happen, like that. We're all so used to things being rolled out with big amounts of money, and they just sort of happen overnight. But when it's down to communities, I mean, building back that community, so important in so many different areas, with the food, the farming, and our health, which of course is paramount to us. And so how is the awareness going since that fundraiser?
It's going well. We've just today, Matt Letitia has come on board as an ambassador, and working with people like you and Matt just helps to get the messages out there. So we've got a great team of ambassadors who support us in many of our projects, and we keep building. Social media presence is building all the time, and it's great.
Yeah, that's definitely going to be a big focus for us moving forward. But I think getting people together in their communities, highlighting what each of the hubs are doing themselves, because this really can't happen without people on the ground doing the work. And there are such brilliant things going on. So what we try and do is highlight what is going on there, so that it kind of gives them a platform to share their news, and also help inspire other people who might be thinking, oh, I'd quite like to get involved in something, or I'd like to set something up, to then do the same as well. So it's been a very busy year. I mean, the website literally launched today, and that is going to be a key driver for us moving forward. We are putting lots of hub resources as we get them, because this is all part of the learning journey. We're doing it all together and learning from each other, and what's working, what's not necessarily working so well. So there's a huge area on the website that we're just going to keep building resources for that. There's also a community group directory. So like you said earlier, it's all entwined. It's not just health, it's not just food, it's education, it's the entire community build up, and how we can be completely self-sufficient moving forward. So the community group directory is any community-based initiative that wants to join. It's not just for PHA, it's not just for health hubs, it's really for anyone who is doing something in their community for the people, and wants to help health creation, because it is everything, isn't it? Really, it's all linked.
I'm just showing the your new website. So I'll put the links in the description so people can go and explore it, and I hope they will. And I'm just trying to sort of follow what you were saying as you were saying it. It looks lovely and very clean and nicely produced, and you've got a map which will, obviously, as you're searching around for your nearest health or practitioner. How useful is that? That's brilliant.
Yeah, and it will keep building. We've had one incredible web developer who's been with us, and who just pretty much single-handedly built all of this. So I wanted to give him a big shout out, Magnificent Mags, as he's affectionately known. But this is where we're now seeing kind of things evolve, and look at the People's Alliance rather than just PHA. So we're then going to start building resources around education. Obviously we've got the food element, but find out what is going on at local level, because it's really key to building those connections locally, so others can find what is in their area, whether they want to help volunteer for these groups or just share resources across them, because you might have different skill sets. So having that all in one place is something that we feel is going to be really beneficial.
And of course, I mean, I've been spouting out the whole business of you need to be taking back responsibility for all of your stuff, your health, your community, and these things, and not just continually let it out to the government or expect your councils to do things. And we've seen how actually, when you do that, they do very little or do the opposite to what's interest to you and your community. It seems that they're very switched off to what people really need, and I think that's where what you guys are doing is going to be so paramount in these months ahead, especially in turbulent years that we're going through at the moment. So you've also got My Medical Choice. Could you tell us a bit about this?
So My Medical Choice is one of our partners, and we've got some amazing partners and affiliates in PHA. My Medical Choice, we've been working with them for probably the last 12 months. They set up actually from a standing.
Oh, I'm losing you a little bit there. I'm just putting it up on the signal is just a bit weak. Could you just say that last bit again, please?
So My Medical Choice was actually founded by several members of a Stand in the Park group in October 2020, and it was based on protecting our bodily autonomy.
Right.
So it's an amazing service. It's a fantastic insurance policy, if you like. It allows you through legal documents such as an advance decision notice, or otherwise known as a living will, to basically put in a legal document what your medical wishes are. If you're involved in an emergency situation, medics, paramedics, and medical professionals have the first hour is the most crucial. So if you can provide your medical information that's easily accessible, it means that a lot of the time that can be wasted in that first crucial hour can be saved, and you can be given treatment. So you can upload your medical history, things like medications you're on, allergies, previous, any surgeries that may impact devices such as pacemakers, or so that the people can actually deal with your treatment pretty quickly. So that's one of the key things about My Medical Choice. It also means that you can reject certain medical interventions that you may not want to have.
Excellent.
It gives you an opportunity to discuss things like your wishes for blood transfusions, organ transplants, etc., organ donations. So they've got a really great template of an advance decision notice that can steer you through what are really, some of them are very difficult decisions to make, and it simplifies it, but it's not an easy process. You need to go through and make these decisions. So if you ended up in a medical emergency and you couldn't speak for yourself, we have things like medical alert tags that you can have with your login details for your My Medical Choice account. They can quickly access that. We also have cards that can be carried in your wallet. I even have a screensaver on my phone. So there's a lot of ways that, medical professionals are trained to look for these things in the event of an accident. So they can quickly access your details, look at your medical history, and decide what the course of action should be. As soon as somebody accesses your account, it sends an SMS alert to your up to 2 emergency contacts. So they know straight away, okay, Lisa's in such a hospital, she needs me to go as her key contact to support her wishes that she's put in the advance decision notice. So for me, it's peace of mind, and it's really just the ultimate insurance policy to make sure that my medical wishes are adhered to.
Golly, I mean, what you've described is something that's so nicely streamlined. We do wonder in this 21st century why we don't have that already. I mean, it just seems very sensible. I mean, what with the NHS sort of falling apart left, right, and centre. So you would still be going to real hospitals. I say real hospitals in inverted commas. What do you think is there trust? I mean, this is the thing that it seems to me is that there's a lot of trust lacking now because of news coming out of excess deaths to certain things, or that the amount of people who are on waiting lists trying to get in, or they see ambulances left, right and centre and wonder, and stories of course are being proliferated over the internet about horror stories here, there and everywhere. Is there a problem with trust, and is this a good way to get that back?
I think there's a huge issue with trust. So, I, for one, would not. It goes back to what we're trying to do with PHA, give people choices, bring back the power to them to make their own choices. And my medical choice definitely protects people in that respect. And, you know, some people say, well, they may ignore my advanced decision notice. And what we're trying to do is dispel some of these myths, because actually, interestingly enough, number one, their medical staff are trained to take into account these legal documents, but also the onus is on the medical professional. They are liable if they ignore your advanced decision notice, not the trust, not the NHS trust. It doesn't come under that. It's a personal liability. So they're not going to ignore it.
No.
I mean, this is kind of, you know, until we get all of these lovely cottage hospitals back in place, and we've got kind of somewhere where you can go for your primary care, emergency care. But I think we're sort of in limbo at the moment. We're trying to build the new whilst we're watching the old crumble, and it's a good way of protecting yourself.
I mean, we know what's happened over the last few years in terms of DNR being certain groups of people. So again, this appeals and this provides a service for our society.
We're just losing the sound for some reason. I'm not quite sure. 1 minute it's there, and then suddenly it phases away. So I apologise for that, ladies and gentlemen. We have a back room working on it as we speak. He lies glibly. So sorry. Can you I'll just get you to repeat that again.
Yeah. Last few years, you know, we do not resuscitate.
Yes.
Blanket DNRs being put on groups of people, whether it's the elderly or disabled. You know, this has happened. So you can put that into your ADN, your living will, you know, that you would not have a DNR put on you. So there's lots of different avenues, lots of different things that MMC can do to protect you along the way. And I think it's really important for people to understand what this can do for them.
And so,
I mean, it's there's an annual fee of £30 a year, and I look at my insurances that I pay for. You know, your house insurance, home and contents, your car insurance, that you're forced to do all of these things, and this is just £30 a year. That for me is just such a huge peace of mind.
Gosh, and I mean, that seems incredibly good value when you're considering all that's in place, especially in this day and age with uncertainties of this, that and the other. And you hear certainly certain people who they say, oh, well, we'll just put them on some Liverpool pathway and deal with it surreptitiously. And, you know, if you're able to protect yourself and your loved ones and the whole family, you know, that
Absolutely.
seems to be the problem now, is that somebody's gone to hospital and you need somebody there just to make sure nothing untoward takes place.
Absolutely.
So that does seem a good decision for people to take.
It's also the other thing about my medical choice. It's not just for in an emergency situation. I'd say that's probably the key worry that we do have.
Yes.
But it also educates people. There's a lot of educational material on the website. So considering things like blood alternatives, you know, bloodless surgeries. We've worked quite closely with the Jehovah's Witnesses on this. So if you've got certain requirements for religious or other reasons, then this helps you to navigate that system and look for alternatives. You also, when you join, get a pre-consultation pack, which is to guide people through consultations with NHS staff. You know, it can be pretty daunting if you know that you need a surgery and you've got to go and meet a consultant. And people often feel blindsided. So this pack helps in preparing for these meetings, how to deal with the consultant in a respectful but direct way that says, I'm actually quite knowledgeable here. So I know I've already done my research and I already know that there are alternatives to what you're offering me. So again, it's about empowering people to take back control of their health choices.
Yeah, no, and that's very so it's so important now. And you mentioned blood just now, and of course there'll be a number of people who are slightly concerned about types of blood that might be infected with or injected with something which perhaps they don't want, and that can be a big turn off for people, which could be a life threatening thing if they don't know there's alternatives to operations that don't need to deal with different types of blood. So that's very important.
And My Medical Choice does also offer a national donor database, which
Oh, does it?
you can choose to join as a donor, or you may look for a suitable donor. I personally would only have my own private donors that I know, but it's there. It's an option for people. But we would just always stress to do your homework, develop a relationship with a potential donor, and make sure that you've satisfied yourself that it's safe.
You mentioned earlier on mental health, and that does seem to be a very big thing at the moment. There's a lot of people under stress. There's a lot of confusion in life and where things are going. And I know that this is a big area that you're exploring. Can you perhaps tell us a bit about what you're doing to address those sort of problems?
Yeah, so we've recently launched a mental health project, and this is part of why we had the gala dinner back in September to raise funds to be able to provide this. And we're looking at three key areas in doing this. We're building on our practitioner directory, which you've seen on the website, but specifically for mental health practitioners, local. People can see they can look into their own area and see what practitioners are available. The second part is that we're looking at building a resource library. So this is articles and blogs, workshops, all those great things that people can access direct from our website. And the third area is signposting, and this is really, crucial because we're gathering all this wonderful information, and there's some amazing organisations and practitioners out there doing wonderful stuff. But if we can't actually help people get to where the information is, then we'll be failing in the project. So signposting is going to make a big difference in this. And again, this is where people like yourself and Matt Letitia come in. Matt's already said that he's keen to support the project. And we're very passionate about engaging the youth in a lot of these things that we're doing, because I think ultimately, we kind of screwed up with the current systems. So if we're building the new, we need to engage the youth in that. So Matt's going to help bridge that gap and engage the youth into some of these discussions. So yeah, we desperately need people to come forward. If you're a practitioner, if you want to volunteer some time to us in supporting this project, we are very much volunteer led at PHA, so we don't have the funds to pay people to come in and help on these projects. So there's a number of ways that people can get involved. They can donate via the website, or they can volunteer some time. And we need all sorts of people. We need admin, we need social media to help signpost, graphic design, video content, blog writing, articles, all of these things. So there's something that we can all offer.
And I would also add to that is that the point of what we're trying to do in all of our projects are about engaging everyone's support. So it's not just about PHA are doing this, we're trying to get rid of that top down, telling you what to do type thing. It's about engaging everyone, because everyone's got some brilliant ideas that they can share, things that we haven't thought about. So I would really stress the importance on the reason that we want to have all of these different people coming in, is that it's for everybody. What we're trying to do is for everyone. And in order to do that, we need people to be able to contribute, to volunteer their time. Like Lisa said, the written articles. I mean, we want a lot of self-help stuff as well. So the directory will focus on organisations that provide local level support. for community initiatives. We've got a number of the hubs do focus on mental health support, so they will be listed on that directory as well. But really low cost and free services that are available to people is going to be the key thing here, as well as the self-help element. So what can you do? And we're not looking at mental health in just the mental capacity. It's the overall emotional well-being, spiritual well-being. I mean, it's taking that really holistic view. So it's going to look differently. You might have some frequency healers on there or some sound healers. It's not just going to be the talking therapies.
Yeah.
And this, I mean, this is really exciting. It's really exciting times, because if you look at the past, we've kind of separated everything, haven't we? So health is just one of those things that's somewhere over there or whatever, and food is somewhere over here, and exercise, and they're all separate things. And then alternative health, that slightly weird thing about sticking needles in you or having a hypnotist, that's a sort of freaky thing over there. When of course, actually, this is all about life. It's all about living and thriving and having a good life, and being healthy shouldn't be just that thing in a box that you just I'm feeling a bit ill, so that's when I do that thing, and I go and sit there in a depressed room with a bunch of other ill people. But actually, your life and community is about helping one another all the time and integrating all those things, isn't it?
Yeah, absolutely. And it's very much about prevention as well. So if we can educate people in how to prevent disease, and that involves mental well-being as well, then prevention's better than cure always. But what we're trying to get to is the root of the problem, rather than sticking a band-aid on it, which is what we see in the current systems that we face.
And I mean, that's the thing, getting to the root of the thing. So if you're eating healthily, as you've got good quality food, the food is already helping your physical health and your mental health, the community, and helping one another. People love to help somebody, and they get such satisfaction of being of service to somebody else. And when you get all those things working in the right order, suddenly your community is thriving and you're helping one another. And it isn't this sort of, as you say, here's a band-aid for a problem, now go away and come back in 6 weeks when your leg drops off. It's it's a completely different thing.
Just looking at all aspects of community, education is the big one that we're going to be tackling next. Imagine if we could educate our children how to grow food, all of these things that they need to be able to sustain a healthy life and a long life. So yeah, it's exciting times for PHA, which is organically moving towards the People's Alliance and that umbrella of every aspect of community life.
What's wonderful is that everyone else is sort of on the same page. We've all kind of grown together with this, starting with PHA, but everyone's going, well, actually, we need to have a food area in this hub, and we need to be able to have this education piece and care and local commerce. How can we really build this self-sustaining community? It includes all facets of that. So I think what's wonderful to see is that it's naturally happening out of the hubs that are formed within PHA, and it's naturally happening with PHA itself. And that will be the next website, will be the People's Alliance.
And it's happening all around the world. I mean, very quickly, I think we were only 2 or 3 months old when did the interview with Pam Gregory, and just took it to an international level. And the amazing thing about us, so many people had the same vision as us, and they reached out overnight. It just went crazy, and they were saying, I've been dreaming of this for 20 odd years, and it's what I've always wanted to do. And we've helped to facilitate that. Australia, New Zealand going from strength to strength. The US has come on board, and they're building countries across Europe. So we're also able to tap into our international family. So, for example, with the Mental Health Project, we're engaging with, it's a global issue. It's affecting us all. So we're able to tap into their expertise as well, bring them on board, and they're helping with the project. So
I had a brilliant story actually of the international network where I had a message from one of the hubs in Australia. Who said, "Oh, I've got somebody who's on holiday here, but they really want to get treatment back home where they live in Kent. Have you got anything?" And within a couple of minutes, I spoke to somebody in the Kent hub, and they were like, "Oh, here you go." So you think from that side of the world to here with very little money, we are all connecting, and that's the biggest piece. That's why the community hub directory is so important, because it's linking everybody up, and it's kind of taking away the ego of this is mine, this is, you know, this is us. And if we are all in alignment and the ethos is the same, very much in service to each other, and supporting the community, then we're more than happy to jump on board. So if there is anybody that's watching this and would like to join the directory, please do this for free.
And you mentioned there being away from home or something and something happening. I mean, what with some of these newer technologies and alternative medicines like bioresonance and things like that, people, you know, you don't actually have to be in the same room. So many consultations can go over the internet and say, oh, I happen to be in, I don't know, Marbella, for example, and you're feeling a bit queasy, but you might talk to your medical practitioner and say, oh, you know, what would you suggest? And they can do these things because, you know, the knowledge that we're gaining, which is not being told to you by the traditional medicines and big pharma, is that, you know, things like water transmits to each other, blood talk to each other, even though you're not in the same room. I mean, it's absolutely incredible. And these are the sort of people that will no doubt be desperate to be on your directories because they can bring people together.
Absolutely. And the directory actually does have an option so people can say whether it's in person or it's remotely. So it's a UK directory that we've got, purely because of the space it takes and the server searching. I don't know enough about it, but from our tech side, it puts a lot of weight on the website. But there are directories that are being built in New Zealand, Australia. So it's just being able to link everybody up. We've got an international page where we can do that as well, so people can find what else is going on around the world.
But I mean, it sounds absolutely incredible. And you, as you say, you're only 2 years old, and already this is sort of swamping. We have to think, in some ways, I look back to what happened 4 years ago when we were all clamped inside our houses and in great fear of some horrible lurgy. But actually, that sort of kick-started a whole things that were bubbling about what would be good, and has now kickstart this sort of stuff. And you said, you know, people have been saying, I wanted this for 20 years. So in some ways, although a great harm has been put on to a lot of people, actually from the ashes, you know, the phoenix is arising. And
I think that's really key, though, isn't it? That it's very easy to look at what's been done, focus your attention on that. What I prefer to do, that my colleagues in PHA do, is focus on building the new. So the positives, what can we take from this and build something so much better for everybody? You know, so putting the energy into that, creating the new, and helping others and being in service to others.
And let's face it, the NHS isn't going in that direction at all, is it? I mean, if anything, it's sort of going down a road that's petering out, and it looks like they just want to privatise everything. And that's, you know, and it's all just about big bucks and making as much money, whereas this is about building a community, and health is only one aspect of that community, but it's all integrated.
And making these things accessible for everybody. So it's definitely not about money. It's about being there for everybody, regardless of what your financial situation is. So that's probably the hard bit, is trying to make sure that everything we do, we're not excluding anybody. It's for all people. So hard to try and make that happen.
I guess the biggest uphill part of it is really just getting it out to the people, so people know it's there and can see all the benefits and can see how it can work, and can get away from the old vision and open their hearts to the new vision. Do you struggle with that a bit?
Yeah, well, I think money comes into it. Unfortunately, it's that
Yeah.
double-edged sword. Um, we have a very small team, and they do a fantastic job. They don't get enough credit for what goes on at the back end, but there's not we have social media accounts which are slowly building, but there's no kind of money that's gone into funding to build those. So it definitely is. But I think as things crumble, and they will, and they are, more and more people are going to be looking for alternatives. So we kind of see that what we're doing is laying the foundations now for what's to come, and eventually they will find us when they need us.
And I think you're absolutely right there. I mean, I've been saying this myself in the limited spheres that I have, and that is that people are very much like water. They'll find the line of least resistance, and when they see that it's all working brilliantly and there's this alternative, and people are happy and they're not all down and depressed, or they've got time for you rather than 2 minutes to sort of talk to you, and then here's the pills next, people are going to go, hold on a second, this is great, let's go this way. And then before you know it, there'll be a tsunami of people getting involved, which of course will be great. And you would have laid the foundation, the foundation, which is, of course, the most important thing. So when it happens, you can support everybody.
It's those safety nets, isn't it, for people as they realise what's going on and what they need is to take back. And we're putting those safety nets in place to catch them and guide them as they come into this.
Fantastic. The sound, I'm sorry to say, the sound has sort of waned and fluttered in this interview. I do apologise about that. However, where can people find you then? You've got these two initial websites, Happy Birthday on the PHA. I'll put the links in the description. Are you going to celebrate? Have you got a big cake and all that kind of stuff?
That would have been nice. We didn't think that far ahead.
Too busy working on it. That's what it is. Too busy working on building everything up. Absolutely. So I flashed up the websites before. I just flashed them up one more time if I can remember how to do it.
Yeah, so the website address is the-pha.org. That's where we are kind of trying to move everything towards. I mean, we have a Telegram channel, we have Facebook, Twitter accounts as well, so people can always find information. But if anyone is interested in volunteering some time, there is a volunteer page on the website, so you can get in touch with us. We'd love to hear from you. We're really keen to get as many people involved as we possibly can.
And look, there's some jolly ladies there who are already doing it.
That was actually a hub event in Clitheroe.
And that was on our first anniversary a year ago today. So,
gosh, how brilliant!
Here to tell the tale.
Yes, indeed. And your other website, which I shall also include, is My Medical Choice. Here it is, and people can have a look at that and register, and give a good old hunt round as you do.
And we do have a discount for the first year, so we'll provide you with a link for that, Richard, and you can share that in the description if that's okay.
Everybody loves a discount.
We love a discount, absolutely.
I'll put that link in the description as well. So there we go. That's brilliant. Well done to you. I just, more power to you. Let me know when your next big meal is, and I'll come along and support and give you any publicity and what have you that I can.
Thank you.
It sounds really good.
We try and do a community fundraiser event towards the end of the year again, because it's really, I think the key thing for me doing the fundraiser last year was that it was just about coming together. And actually we spend so much time on Zooms, as I'm sure you can relate.
Well, we're doing it now, aren't we?
Yeah, exactly. But I think that there's nothing like that face to face, feeling each other's energy and just having some fun along the way as well, because it is about having fun along the way too. It's not all work.
I mean, I totally agree about that. When I go out and do my talks and things, it's so much It's more fun seeing people, them having that engagement. They know you're real. They can poke you. They can ask you awkward questions, and they do, as opposed to just stuff that's online which you just scroll past and go, oh, that was quite interesting, and then they've forgotten about it. There's a buzz where people are, and they meet other people. And go, oh, I didn't know you did that. Oh, you must tell me more about it, which is, fantastic. It's not, we've all been positioned behind these screens, but it's good to get out in person, because that is what life is all about, really.
Yeah, for sure.
Brilliant. Well, thank you very much, ladies, for coming on and telling me all about it on your second birthday. And I urge the audience to go and check out the websites and investigate further and support as much as you can, volunteer, and all of that. And presumably email addresses are on the website so people can get in touch with you and all of those things. So
Thank you for the support. We really appreciate the support. It's fantastic.
Well, happy to have you on the show. A bit of glamour always helps the show go down well, I always think. Otherwise, they just have to look at my bald old face. So there you go. So thank you very much for coming on. That's Amanda and Lisa from the PHA. I will be back with more monologues and, of course, wonderful guests. In the meantime, from us all, take care. Bye for now.